Capsugen. Expect more.
Now the sequencing for NeoRevive is 6 minutes of exfoliation and 8 minutes of dermal infusion. And so our segment will be 3 minutes of exfoliation on one side, 3 minutes of exfoliation on the other, and then we're going to change product, reapply the product, and then we're going to do the dermal infusion afterwards. So we're going to take our fresh Capsugen. Each client gets a fresh Capsugen each treatment. And we're going to remove the tin foil and it just simply clicks into the handpiece, the vibrating handpiece, like so. Then we're going to take our handy little cup and we're going to put our product in it. Now, to do the oxygenation process, I personally like to use about down to the red line. I like to use a little bit more product to make sure I have a really good frothing and so that we have a lot of CO2 happening on the skin and we get a good oxygenation process. The viscosity of this product is very thick, so even with roughly a little bit more than a third product, we should have more than enough to effectively do a nice dermal infusion at the end. So we're just going to squeeze all of this in, like so, and save our product for the second part. So right now I am going to start applying the product quite thickly because again I want to have quite a bit of product to interact with my vibrating head, the Capsugen. The Capsugen is made of sodium bicarbonate, citric acid, and some magnesium. And what happens is this product interacts with the vibrating head. Several things happen. It creates carbon dioxide bubbles, causes a little bit of foaming. That carbon dioxide is sensed by the body, and the body, to offset the CO2, sends oxygenated blood to the area to whisk away the CO2. Simultaneously, as the Capsugen, that little vibrating exfoliating head, breaks down, it becomes a little rough, becomes a little textured. So that in itself helps buff off all of that dead skin in a nice, gentle manner. So right now we're having this beautiful hyaluron product that is full of peptides and antioxidants, vitamin C, in a hyaluronic acid base. And you can get quite close to the eye. Just don't want to get it in the eye, but you get quite close to the eye. And so that your sensitive eye area that often needs a little bit more love and where it has increased wrinkling and such, and nicely in the nose as well. Now we're done that. We're going to take our vibrating handpiece, and again, this puck here is the exfoliating head. Instead of traditionally using vacuum like microdermabrasion does, this actually vibrates to cause that exfoliation, and it's very simple. We just start doing nice small circles in the area. I like to lather it up and go quite quick just at the beginning, just to get it foaming as soon as possible, and then I sort of go into target areas that might be more of concern to the client as soon as I have everything frothing up here. Now if you can see this, the side of the face, you can see how it's turning white and frothy. And now I'm going to slow down my movement a little bit just to concentrate on a few areas. She had some hyperpigmentation here on the side, so I'm going to spend a little bit more love there, a little bit more time in this area here. And again, unlike other modalities that uses vacuum, it's usually very hard to clean around the nose area, because you lose vacuum and you lose efficacy when that happens. So with this, because we're using vibration, you can see we're treating a lot of the face all at once. We're going all over the place, and we can really effectively go into the nose area where there's usually a lot of comedones. People want extractions, but they're very hard to extract, and this effectively helps reduce them. So we're going to continue this exfoliation process for 3 minutes on the NeoRevive. Now some people ask if I go back and forth. I do not, because I really want to make sure that this side of the face is well oxygenized before I move on. And Farah, how's this experience? How does it feel?
It feels very good. I can feel the bubbles a bit.
Is it irritating at all?
No, not at all.
You feel a little bit of warm sensation?
Just a little bit.
Yes. Lots of times people experience what they seem to be a warming sensation, and that is when, similar to a fever, for instance. When your body sends a lot of blood to any area, you feel heat, you feel it. So a lot of times you'll feel a little bit of warmth. I've had some clients say, what kind of energy is being used? There is no energy. This is not an energy-based treatment. It's just the product interaction. And that warmth they're feeling is just the oxygenated blood coming to the surface of the skin. And Polygen, in their numerous studies, they all of their technologies is tried and tested and true. They have tested the technology, and even 15 minutes after treatment, the oxygen levels in the blood is up to almost 20% increased, and that's significant. So what's my timing here? I'm soon going to go to the other side. And you can really see it fizzing up around the nose, which brings a lot of clarity. Farah has beautiful skin, so she doesn't need any comedones extractions. But to someone that was having acne, for instance, that would be a really nice treatment for them. And you can really do a nice exfoliation in the chin area as well, again, because there's curvature here, but we're not having to compensate with vacuum. There's no tugging. We can get quite close to the eyes here without tugging and pulling as you would with anything that uses vacuum or any photopneumatic device. You can see the foaming here quite nicely on the face, and that is the CO2 that's being produced, like I mentioned before. So this is a great treatment for anybody that's just getting into the skincare regime. It does a lot of everything. It does exfoliation, it does oxygenation of tissue. I had mentioned earlier that the blood supply that this draws up to the surface of the skin via using the Bohr effect. The blood is basically the transportation system of the skin, so of the cells. So when I'm infusing this really nice high quality hyaluronic product, which is infused with peptides and vitamin C, it really gets to where it has to go because of the increased blood supply to the area. So the whole treatment is quite dynamic, and when the client is having this done, they feel how active it is on their skin. It's a very, very unique experience. So how's it feeling, Farah?
It feels fine. I just feel a little tingling and all over. It's very comfortable.
And you can really feel your skin being exfoliated well. Can you not?
I can feel that.
Yes. This is probably one of my favorite, or if not the favorite, exfoliation technology that I've worked with up to date. I love the fact that it doesn't use vacuum. I love the fact that it's very safe and very effective for all skin types. And I love the fact that it's easy to do. It's a very easy, simple treatment. And the results are lovely, and it's one of those treatments that people just come back for. They come back again and again because it offers so much more than your traditional facial or exfoliation treatment. Typically with a microderm or a peel, you'll leave with your skin dry and dehydrated, not dehydrated, but at least feeling a little bit irritated. With this, your skin is so hydrated after the treatment and so infused with so much wonderful product that your skin just feels amazing. So it's a big demand service. So now we're done with the exfoliation, and for the Revive, it's 3 minutes on one side and 3 minutes on the other. And just to review, at the beginning of the treatment, I did quite quick, the circles quite quickly in order to get the foaming action of the CO2 more active right away, and then I concentrated on the areas of concern. You can still see how nice and pink her skin is on this side from the last treatment. It's already calming down on this side. But on this side, how the body naturally sends blood to the area, again, without vacuum, just it's a normal, natural flushing.
Polygen. Expect more.